Going to take the next hour or so, the Doctors Caucus, Dr. Gingrey, myself, Dr. Harris, and we're going to speak about the Affordable Care Act, how we got where we are, the plan to save Medicare, and other health care issues. I came to this Congress after a 31-year medical practice in Johnson City, Tennessee. Just a doctor out each day in East Tennessee taking care of patients. And I made a decision that I didn't like the direction that the country was headed in health care, and I wanted to run for Congress to be here for that reason. Well, it turned out that 2 Congresses ago we did have a debate on the health care issue. We have 9 physicians in our health care caucus, and not one of us was consulted about that health care bill. Not one of us was brought in the loop and said, "What do you think?" Well, we had an extensive debate, I will admit, in the House. This bill was passed on a pure party line vote in November of 2009. And on Christmas Eve, the Senate passed a bill that had not been vetted, had not been heard in the House, was not debated in the House, a completely different bill. But because of the rules in the Senate, it never got heard here and was not debated fully in the Senate. That bill was passed, will soon be 4 years ago. We thought, 3 years ago, we thought that we'd have an opportunity after the Supreme Court looked at this, those challenges were brought, to overturn this bill. And we're going to spend the next hour explaining why we don't think it was the right prescription for the health care of the citizens of this country. And I bring an extensive knowledge about a health care reform bill we did in our state of Tennessee. The biggest problem with the health care in this country is not the quality of care. Certainly we can always do better, and physicians want to do better and have new techniques and new innovative medicines that we use. But the biggest problem with health care in America is the cost of that care. I got to see it every day in my practice where going to the hospital could bankrupt families if they didn't have proper insurance. It was more expensive to come in, and so the number one driver was cost. Number 2 was there's no question that we had a group of people out who worked every single day of their lives that could not afford health insurance. It was not affordable for them. I would see it in my community where you would have let's say a carpenter who would work, and during the winter they didn't get to work too much, but they would work and maybe make $20,000 or $25,000 a year. Their wife may work at a local diner maybe and make $20,000 or $25,000 a year, and together where we live, they could make $40,000 or $50,000 maybe in combined income, and they could live okay, but they could not afford $1,000 a month for health insurance coverage. It was just out of their reach. And thirdly, we had a liability crisis in this country. So what did the Affordable Care Act actually do? Well, it did increase access, but it increased access mainly, the best I can tell, through a massive expansion of a failed system called Medicaid. And the Medicaid system right now in this country is broken. It needs to be reformed. We did not reform it with this bill. So that's one thing it did. 2, it did not touch liability. And we can go into that a little later, but the liability crisis still exists. Some states, my state of Tennessee has done something, the state of Texas, California. Other states have been successful in liability reform, and that has helped. But the president here Tuesday night, we were all sitting in this chamber, and amazingly, in the seat or just right below you here on the dais, the president said with a straight face that his bill, his Affordable Care Act, so-called Obamacare, had lowered costs. I was astonished by that because it clearly has not done that at all. And let me just go through a few things. I serve as the chairman of the Health, Employment, Labor, and Pension Subcommittee in the Education Workforce Committee. So if you have a private health insurance plan, that plan will come through my subcommittee. And let me just go over a couple of things that we found. We've had numerous hearings over the past 3 years about this, and this is recent data right here. President Obama's health care law will push about 7 million people out of their job-based insurance coverage, nearly twice the current estimate. That was just in the last week or two. That estimate has been, according to the latest estimates of guess who? The Congressional Budget Office, not Phil Rowe and not some congressman, but the CBO believes that. So twice what they thought it would do. Spending on health care is up, and we estimate as much as $4,500 per family since this bill has come into play. That is not pushing the cost of health care down. So we see that. And one of the things that this bill did, I think, which was good and bad, Mr. Speaker, was that we allowed millions of young people under the age of 26 to be on their parents' health care plan. That sounded like a good idea, and if you have a mom and dad that pay for that, it probably is a good idea if they pay for it. And I know one of the great points of my life were when my 3 children got out on their own and paid their own health insurance. That was the biggest raise I probably ever got, was getting out of college and paying their own health insurance. But what happened was, the way the bill was written, actuaries can no longer charge the actual cost of that care. Let me give you an example. If a person my age is out buying an individual policy, it will cost about 6 times what a young person under 26, because actuarially I'm much more likely to need health insurance or need my health care plan. Well, the actuaries now, this bill only allows a 3-to-1. So that means a young person is going to pay 2 to 3 times that person out there paying for that health insurance coverage than they otherwise would have. I've had a good friend of mine who's in the individual market, health insurance market at home, and all 3 of my children, I bought them individual plans, and I specifically remember exactly how much I wrote the check for. He said, Dr. Rowe, he said, I was having these plans for about $100 a month, just a basic health care plan, some less than that, depending on risk. Immediately after that bill passed, those rates tripled. They were $280 a month. Well, all of a sudden now, if you're an individual, that isn't affordable. Most people don't have an extra $200 or $300 a month right now in a tight economy to do that. So we've made it less affordable for a lot of young people, more accessible, but less affordable.